if I look at your numbers at the initial presentation, your monoclonal protein was about 4.5 grams per deciliter. And the biopsy that I had done for the bone marrow showed almost 80% of the cells in the bone marrow were abnormal plasma cells. It's a pretty high number. You did not have any overproduction of light chains. So it was really this monoclonal protein. And then we started on this 3-drug combination with bortezomib and lenalidomide and dexamethasone. And immediately we saw that the monoclonal protein went down. And we gave you the second cycle, and then the third cycle, and then the fourth cycle, it almost kind of plateaued out, the monoclonal protein. It landed around 1.4 grams per deciliter. So because it went down by more than 50% from the initial, that would be a partial response. And we had this discussion whether you should do a transplantation with melphalan or not.
Right.
And I said to you, you have a high number of plasma cells at diagnosis. You had a quite high number of the protein, and now we had plateaued out. So I said, I think the transplantation is probably the best thing for you. So we decided together to do that.
Right.
And then the transplantation was done, and you had a lot of toxicity from it, as you told us before here. But the numbers went down for the monoclonal protein. So it went down to, I think, 0.2 grams per deciliter. And we did a biopsy, and it looked like a normal bone marrow, so less than 5% plasma cells. So that really took away a lot of the disease cells. And we had done the bone marrow before the transplantation, and it showed about 20%. So from that 70, 80% down to 20% with the combination therapy, and then down to normal bone marrow after the transplantation. Those were the steps we took. The numbers never went down to 0 in the blood. So we couldn't really look for minimal residual disease because the protein has to be 0 in order to look for those last cells. We could find some cells if we look with the more sensitive assays, and that's why we also found this low-level protein. And then you chose to do no maintenance because you didn't want to do more therapy. And we followed with blood tests, first every month, and then we did every 2 or 3 months. And the proteins were still about the same. But unfortunately, about a year later, they started to go up. You didn't have any symptoms at the time.
No, not at all. I didn't have any symptoms. I was fine.
So I remember I said to you, unfortunately, this is something that can happen, that the proteins can go up. But normally you wouldn't have symptoms. You had no pain, you had no fatigue, you had no nothing. No. And then we talked about what does this mean? Do we need to start you on therapy? What therapy would that be? And you said you didn't want to do therapy unless you really had to.
Exactly.
And we checked again another month later. It was about the same number. It was 0.2 or something grams per deciliter. And I remember we checked multiple times. And next time, I think it was the same. It was 0.3. And you told me you didn't want to do therapy. And we kept on checking. And I think we kept on doing that till it was about 0.7 or 0.8. And I said, we probably should think of starting therapy.